Evening, everybody. It's 6 o'clock Eastern time, which means it's 3 o'clock Pacific time, which means it's, let's see, 5 o'clock Central time. And I'm saying all this because this is our last, for this series this year. This is our last part of our series, the inaugural series that we have had with Dr. Vin Gupta. And everything after our measles town hall, we've been doing this once a month, has been basically things, issues, um, professional development, uh, things that you have told us you wanted us to talk about. And it's just been really remarkable to have these kind of vital lessons on a month to month basis with Vin Gupta, who is an extraordinary doctor in his own right. And what he's done and what he's helped us do is really provide educators and nurses and public employees and retirees, and frankly, anybody else who is joining us with facts and tools that they need and for a healthy life. And, ultimately, we would wish that the government was doing this for us, like the CDC is supposed to do and the Health and Human Services Department is supposed to do. But I think, as we've all seen, they've made our lives harder, not easier. So today, this is a topic that I very much wanted us to do, and I think it's great that we're doing it in our inaugural year, but as our last monthly town hall before we start again in August. We want to give people a break in July. It's on wellness. It's on taking care of ourselves. And, you know, I would say that the anxiety these days is quite high everywhere we look. Um, I don't know about any of you, but last on Saturday night, um, when I saw what was happening in Iran, regardless of what anybody thought about it, it reminded me exactly where I was and what I thought about on 9/11, and where I was and what I thought about when we bombed Iraq, and where I was and what I thought about when John Kennedy was murdered, or Robert Kennedy was murdered, or Martin Luther King was murdered. A sense of tremendous powerlessness and what is going to happen next. And we have lots of that in our lives, and it doesn't and what and we have lots of that in our work. And so that's why today we really wanted to talk a little bit about self-care, and self-care as we start this summer, on a day that on the East Coast it's over 100 degrees out. You know, a little bit, we could talk a little bit about climate change too. But what makes it harder is that, you don't have real public health guidance anymore. And also, what makes it harder is that we have a very broken healthcare system. And in, different venues this week, we are fighting to keep Medicaid and Medicare and nutritional services so it doesn't get worse than it is right now. But it does feel like it's really anxiety producing. So that's why today we wanted to talk with Dr. Vin Gupta, who has helped us lead this series with empathy and clarity and science and heart. I could listen to him forever. And then we have a special guest, which Dr. Gupta has been doing with each of our programs, um, who really knows this topic inside and out, and that's Dr. Mandy Cohen, who's a former CDC Director and Manat Health National Advisor. And Dr. Cohen is a longtime public health champion who understands what it takes to make wellness a reality, not just a rhetorical, nicety. But who we also have as well is one of our members, who those of you in Connecticut know quite well, many of us who represent nurses know well because we've worked with her on picket lines and in the fight for safe staffing. And that is Sherry Dayton, who is one of our leaders at Bacchus Hospital. And so what I want to do is I'm going to turn it over, just like what we normally do. I want to turn it over to Vin as he comes on, and to kind of start us talking about things like, you know, what stress and burnout do to our bodies, and what are we trying to do about it, and whether it's high blood pressure or sleepless nights or fatigue and brain fog, or the fact that we routinely, I'm speaking for myself here, I have my doctor, my annual physician, I have her number on the top of my calendar, as I have had for the last literally 8 weeks, and never call, but this constant sense of pushing ourselves to do more with less, and all this anxiety. So help us navigate this hour for us, Vin, in terms of how we try to create more wellness in our lives and a better balance in our lives.
Thanks, Randy. Hi, everybody. It's great to be back in this national town hall environment with AFT. I always do this for every one of our other town halls, but it's really important just to say that without Randy setting the tone and your team setting the tone and investing in this with your time and your effort, none of this would be possible. And so if leadership isn't aligned to provide these information sources across channels, we do today's lesson, or today's news, tomorrow's lesson. We've been doing content for that information channel. We've been doing blogs after we come out of these types of town halls. We've been talking about measles, youth mental health and ADHD. Last month, we had a really well-received national town hall on women's health and specifically perimenopause awareness. And Randy, without your leadership to set the stage and to provide this environment for us to have these conversations, it wouldn't happen. So thank you. I want to, before we kick it off, we have a very special guest joining us today, Dr. Mandy Cohen, who I'll be introducing in just a second, bringing on for a discussion on all things wellness. Pretty big topic here, so we're going to try to carve out as much as possible. And the usual disclaimer, if you have questions, we're not going to, this is not death by PowerPoint. We're not going to just go through slides. Please, if you have questions, we're going to be looking at the Q&A throughout, and we'll just be breaking this up and having a conversation with all of you. And then again, sharing key distilled points after the fact so that you have information that you need to keep you and your family as safe as possible. But building on the May town hall, that I thought there was so much engagement, so many great questions on broader issues of wellness. I did want to bring Sherry, if you wouldn't mind coming on, and I'd love to understand, I see over there, I'd love to just, you've been kind enough to share your own personal wellness journey with us and the importance of being proactive, of initiating diagnosis and treatment as early as possible. And I was wondering if you could just share, as an AFT leader with your fellow AFT members, the importance of wellness, of engaging with healthcare through just your specific lens.
Thank you. So for those of you who don't know me, I've been in the medical field for 33 years. I've done just about every aspect of the job, from being a home health aide to a CNA to a PCT to an RN, and now I am an APRN. It has taken its toll. When I first started healthcare, I had 4-to-1 patients. I was able to take a 15-minute break in the morning, maybe have lunch. Sometimes I missed the 15-minute break in the afternoon. But as the years rolled by, my 4 patients became 5 patients and 6 patients and 7 patients. And then, by the end of me being an RN in acute care, I was like 12-to-1 sometimes. It's crazy in the ER. That's where I spent most of my career. And it's taken its toll. It definitely took its toll. About 1.5 years ago, I was diagnosed with an autoimmune condition. Throughout the years, I started having more joint pain, more fatigue, inability to lose weight, and it just didn't feel well. And when I look back and I talk to my providers, they were like, well, Sherry, you work in a very, very high stress job, and we all do, and the stakes are high. And as a good healthcare professional, we always put our patients first. And so there's times where you might go 12 hours without eating or drinking, or maybe even being able to use the bathroom. And this does take its toll on you. So, through my healthcare journey, what I started doing is I started making little baby steps. First make my goal of drinking enough water a day, which seems like such a small goal, but can make a huge difference in our health. Making sure that we do something for ourselves, whether that's a walk or going to the gym, getting some activity that we find enjoyable, even if that's just going out dancing, just to get some activity for yourself. Making sure you eat better. These little things can really do great in your life. And I have slowly been trying to add them in baby steps by baby steps, because it's hard to fit that in a healthcare profession. I still, even as an APRN, see a patient every 15 minutes. That's, as Randy said, our healthcare system is broken, and we are very short, a lot of staff. And so, the ones of us that are left here pick up the slack. But I caution you all to really pay attention to yourselves, because if you don't care for yourself, you will stop being able to care for others. So please make yourself a priority, and don't wait 33 years to start doing that. I appreciate the time to talk to you guys.
Thanks, Sherry. Thank you for that call to action. I just a remark on that. I do think, I think about so many people who the lives are busy, and it's seemingly too hard to do, but say their employee benefits allow for them to set up an established care appointment with a primary care doctor. And, of those people in the country, there's many people who are underinsured or don't have access to healthcare insurance. But there are a lot of people who don't prioritize, because, again, life is complicated, setting up an appointment with a primary care provider. And I think for the reasons you mentioned, it's really important to stay engaged. We're going to talk about critical screenings that we all should be thinking about, because I think we can't have this conversation enough. But Sherry, thank you for that call to action. The purpose here of these town halls, again, is to bring the best experts in the country to all of you. So I'm going to try to do as little talking as possible. And I want to formally bring in Dr. Mandy Cohen, the recent former director of the CDC. Dr. Cohen, thanks for being here.
Good to be with everybody.
Mandy, I know we've had this conversation a few times, but just wondering, there's so many things that we could be talking about, and we'll be talking about a few specific topics within wellness. But you lead a very busy life. You have a family, a busy professional career. I'm wondering, just building on Sherry's points, what you think gets missed when it comes to this topic on wellness.
Great. First, Vin and Randy, thank you for having me here. My dad, long time for his whole career, an AFT member. And so thank you for what you've been doing. He worked in the New York City schools. He was a special ed teacher and then a guidance counselor. And so thank you for what you're doing. And I think that this is such an important topic about making sure that you are finding ways to keep yourself well, because I find folks who are teachers and nurses and others, you all are givers. You give. But the only way to continue, as I think Sherry said it the best, if you're not taking care of yourself, you will not be able to continue to give. So, and it feels overwhelming to be on a wellness journey. It feels like you have to do all the things perfectly, or then you do none of them. And my biggest message to take away tonight, for sure, is what Sherry already said. So I'm just reinforcing the small incremental changes that you can make in your life. You do not have to be perfect. This is about picking something that you think you can do and sticking with it. I think the most important thing is consistency. Maybe that's, as you heard Sherry say, it's drinking water. There's a couple of things even on this slide. Maybe it's, I'm just going to go to sleep at the same time every night and wake up at the same time every night. We know how important sleep habits are. Maybe it's finding a thing that moving your body makes you feel good. I will say for a really long time, I was a runner. I didn't like it. I'm just going to be honest. I did not like running, but I found like when I transitioned to walking, I actually look forward to it now. Like if I don't walk in a day, like I actively miss it. So I found some, you know, it wasn't running, but I found something where I'm going to move my body in a day, every day. Again, how do you do small, consistent things to keep yourself well? And making sure that part of it, yes, is that sleep. It's water intake. It's thinking about what you're putting in your body, but it's also what you don't do as well, right? Making sure some of the most important things is got to get rid of the cigarettes. They cannot play in your wellness journey. And those are hard. You don't have to do those kinds of things alone. That's the other big message is like wellness is not a solo activity. Wellness has to be a team sport. And whether that's getting support from your family and friends, whether it's an accountability partner who you go walk with, or it's your primary care doctor who helps you quit smoking. There are tools that we have to make sure that you can use and do that. So I'm going to turn it back over to Vin, to Dr. Gupta to walk through some more of these things. But I think the biggest message is small things that you can do and do them consistently. You do not need to be perfect here, but it's those small little consistent changes.
I love that, Mandy. I haven't heard, I don't think I've heard that enough, this sort of notion that, well, consistency matters, absolutely, but not letting perfect be the enemy of good, and that incremental steps are really important. I do think that there's, between social media, sort of reality TV and everything in between, it feels binary. Either you do it all or you don't do it at all. And I have a really important point. And I like the point on an accountability partner and, you know, somebody to take a walk with, somebody to, you know, if you're not feeling well, to communicate that to. Really, really important. I wanted to, I'm just going to sort of sprinkle in things as Mandy's chatting and talking, get a reaction to it. But I think on sleep hygiene, Mandy, your thoughts on, you know, I read statistics that 35 to 40% of the country that doesn't sleep well actually has undiagnosed sleep apnea and should be treated. How do you think about poor sleep? And because I feel like we all suffer from it to a certain degree. And when should you be thinking about actually seeing a doctor or getting help?
Well, first, make sure you're doing the important good sleep hygiene things that we all can be doing. I mentioned them about going to sleep at the same time, waking up at the same time, making sure that you're not on your phone. We know that the light from your phone right before you go to sleep activates your body, right? Do you have a sleep routine that winds down your body at the end of the day? Are you actually putting aside the number of hours that are appropriate to sleep? But look, those are only some of the issues. And I know you just did some learning on perimenopause. We know as our body changes at different moments in time, sleep becomes a lot more challenging. And again, this is wellness is a team sport. This is where you may need to activate a team. And what I would say is always talk to your primary care doctor. Luckily, all of the folks here have the kind of benefits that allow you to connect with a primary care doctor, and making sure that you're asking those questions of like, is this normal? Because sometimes sleep is not going to be perfect, but are you cutting out your caffeine later in the day? Are you going to sleep at the right time? Are you not charging your phone, by your head, which keeps you more activated? If you're doing all of those things and then you're still finding yourself either difficulty falling asleep, difficulty staying asleep, then you want to talk to your primary care doctor, because there could be something underlying, whether it's a sleep apnea issue or hormonal changes. Ladies, as we all know, it gets sometimes pretty hot at night. So those are all real reasons, but there are tools that we can use to help.
That's great. That's great. I'm just jotting down notes because just for everybody that's listening in, we're trying to establish mechanisms in place for those of you that may have missed, or for loved ones that may have missed this, and you want to share sort of the top line stuff. We're going to be doing a readout of all the great advice from Dr. Cohen on these issues and doing sort of a one pager of the questions you should be asking yourself or perhaps your medical provider across these various wellness topics. So no need to take notes. We're gonna do it for you. I will add, on sleep hygiene, if you're feeling, just like Dr. Cohen was mentioning, if you're feeling really groggy in the morning, or if your partner, if you have a partner that is close to you when you're sleeping and they are remarking that you're snoring a lot, those are the telltale signs that perhaps you should have a conversation with your medical provider on whether or not you might have sleep apnea. And I see this in my clinical practice as just I'm a pulmonologist, that this often goes undiagnosed until there's serious side effects, and a lot of it is awareness. We still don't have great awareness that if you experience these symptoms, there's something you can do about it, and it has a huge impact on your quality of life. And daytime fatigue, I noticed that fatigue and poor sleep were numbers 1 and 2 in terms of that the poll that Kelly put up on the biggest challenges to wellness and people's feeling their own wellness journey. Sometimes these things can all be interrelated. So just important to keep in mind. We're going to try to hit on the high points that if you're feeling daytime grogginess or if you're hearing that you're a snorer at night, it's important to establish care with a medical provider and get screened for sleep apnea. Not enough people do that. I also want to just touch on something. This is going to be a recurring theme, and we're going to get to some of your questions. I know we have some already coming through, which is fantastic. And there's another poll here on digital wearables. And Mandy, I'd love to get your thoughts on how, I don't know if you use digital wearables like a watch or a ring, but curious, I read some statistic that almost 50 million adult Americans have some version of some digital device that gives them health information. One, I'm just wondering what you do. And two, how do you talk about the data, or how do you think about the data if, say, you have a loved one is using it, if you're not doing it, or if you are doing it, how do you utilize that data to kind of give you insights?
So I might share a bit about my mom, who has a watch that she uses, and she had some underlying cardiac arrhythmias, and it actually has allowed her to stay on top of her health and use that and integrate it with other information that her doctor has. So I definitely think wearables are an important piece of the puzzle. We want to make sure we're using that in coordination, again, with your physicians. Of course, I'm a little more low tech, but I do track my steps, right? Because again, I think those are just accountability metrics for me, right? To say like, all right, I needed a goal. So I want to get a certain number of steps every day. So that allows me to track it, to really hold myself accountable to a goal each and every day. But I'm a little more low tech, but I've definitely seen wearables be incredibly helpful for my family members to help them manage ongoing chronic conditions.
I love that. Yeah, I know. And just to layer on, again, you don't do it in a bubble. I think a lot of these things tend to be direct to consumer, to Dr. Cohen's point, and you want your medical provider to be in a loop to some degree. But it is a great pre-screen. If you're noticing same trends like in your health app, if you have a watch that's connected to your health app on your phone, or if you have a ring type device, I've seen more than a few times that it gives people insights into their health that maybe they otherwise wouldn't have had until perhaps a problem would have reared its head down the road. And so if you have, I'm not saying go out and get it if you don't have one, but a lot of people have it, and I think they underutilize the potential power of it. And so I'm happy to talk more about that later if there's questions. I do want to get to a question here. Mandy, curious if you have a point of view on this, but since sleep continues to be a big question on people's minds, and we just saw a poll that Kelly put up about what are the biggest challenges to people's own wellness journey, and a lot of the number one response was people don't know what to prioritize. So hopefully we can help them with that. Curious, one question we got was feelings about use of ashwagandha root for better sleep, or the use more broadly, maybe even beyond just ashwagandha root, of OTC medications like melatonin. What's been your experience with any or all?
Yeah. So again, before I want to make sure we're doing all of the things that I would call are those small incremental things I keep mentioning related to sleep, because sometimes we want to take a pill and hope that that can fix some of the other bad habits that we have. I know, and I'm guilty of it too, about being on my phone way too close to bedtime, or having that last cup of coffee after 5 p.m., right? Those kinds of things. So once you've cleaned all that up, I have definitely particularly used melatonin when I'm traveling. And I will say, as CDC director, I was all over the world. We had 60 offices all over in different countries. And so particularly changing time zones definitely helps to reset your circadian rhythm with melatonin. And again, these are great things to talk about with your primary care doctor, because the one thing you want to note is interactions with other medications you might be taking. And so if you are taking other medications, you're going to just want to make sure, hey, are there any interactions here? And look, also, try something. And if it doesn't work for you, you try, take another, look for another option.
Yep, I love that. Yeah, and so just to emphasize, Andy, what you're saying, OTC options, they exist. There's many out there, but it's really the extent that you can leaning into, modifying your lived space. And so I've started doing do not disturb at a certain period of time, so my phone doesn't shine and wake me up potentially. Like you, I have to be better about not using a device in bed. That's ideal though. If you can do that, that's fantastic. Avoiding caffeine, I try to avoid it after even 1 p.m. Mandy, you and I probably should, we have to have a conversation about that 4:30 p.m. Coffee apparently.
Well, and I will just share with folks, and everyone's different. I am caffeine free because I'm a bad sleeper. I just be honest. Like I've found, like, even if I have a morning caffeine drink, I have more trouble sleeping, right? And so again, every person is different, and you learn your own body.
Yep.
Can I just jump
Randy,
in here
please.
for a second? Yeah, because we got a question from someone earlier in the, and she may have gotten some of the answers, but I hear this a lot, and this is a question from Xian, and about, your life when you have, when you're working all the time, and then you have kids at home, and then there's all of these bills to pay and all of these other things. In some ways, what she's asking is, how do we kind of get off that? I mean, and I'm putting words in her mouth. How do we get off that treadmill? How do we get off that constant, how do we break ourselves, at least initially, of that habit to do some of these other things?
Yeah. Well, and Randy, I think you're getting at the question, like, which was in the poll, right? Wellness, exactly. What are the wellness challenges are? We don't feel like we have enough time, and we don't know what to prioritize. Exactly. And so I think there's a couple of things we can tackle there. One, particularly when the number one thing from a priority perspective, and the thing that is going to also save you money, is quitting smoking. So if that is part of your, and I know how hard it is. I know it. But making the choice to say, we're not going to spend money on the cigarettes anymore, and get that out of your life, right? That's the win. You get a little more money in your pocket, and you're on your wellness journey. Beyond that, then you want to start thinking about making sure that you are, again, it's understanding what your risk factors may be. You're going to see a little later that the number 2 thing that I recommend is related to your blood pressure. knowing your blood pressure and making sure it's under control, right? And the things that contribute to blood pressure are your weight, your diet, and also your genetics, right? Did your parents have high blood pressure? So there are things and did you have high blood pressure during your pregnancy? Because that could be a risk factor too. So those are the kinds of things that you want to start prioritizing. So quitting smoking and high blood pressure are the things you want to get after. And high blood pressure has a couple of factors that go into it. Again, it's weight, and it's your diet, and it's your movement, right? So that's where you hear us hitting on moving your body and making sure that you're thinking about your diet. It is often in service of getting your blood pressure in a good range. So those are the things that I would prioritize. And again, I know there's no hours in the day to do this. I have two girls who are 10 and 13. We're all working and running in different directions. So the question is, how do you integrate it into your life? So can you have a walking meeting? Sometimes that's possible, sometimes it's not. So that the time that you were going to spend with your kids, can you do it with them preparing their lunch for the next day? So you're both teaching them about what healthy lunches look like, and you're spending some time together, and lunch gets done for the next day, right? So it's just like, how do you layer into the already busy activities that you have? So that's the way I would start thinking about it. What are the ways in which I don't have to expend a lot of time, I don't have to expend a lot of money, but I can prioritize, again, the things, quitting smoking and thinking about my blood pressure, which means diet and exercise. I think those are the most important things. Oh, whoop.
Got it. Thank you.
Almost got it. Thank you.
I'm going to skip ahead on the slides, Mandy. Yeah, since you did a perfect tee up here, and I know we have a lot of questions to get to, so I'm going to just touch on this briefly so we get to all your questions. To Dr. Cohen's point, high blood pressure is the leading risk factor for disability and for death across the United States and worldwide. It is a clear number one. Dr. Cohen's also been talking about smoking. It remains the number 2 risk factor for ill health and dying across the United States and worldwide. Sort of shocking that we're still there, but we are. And so everything she just said is exactly what we're seeing from a data standpoint. And it's really important. I share this picture. Oh, well, yeah. Silent killer. I've done some ridiculous media. We try to do some PSAs on this not too long ago. I actually have an automated blood pressure cuff that we were demoing because we were asked to demo how do you properly use a automated blood pressure cuff. And there's some studies out there that suggest that of all the people that have one of these automated blood pressure cuffs at home to screen themselves or to monitor their high blood pressure if they're on medications, about 10% of people actually do this as often as they should, because the number one reason why they don't is they don't like the feeling of their arm getting squeezed. It's just, you can actually kind of feel your pulsations, and people objectively just don't like that. And so that's one example of why it doesn't get done as often as we'd like. And it's also a reason why high blood pressure often goes undiagnosed until it's too late. There's an estimate from the Journal of the American Medical Association that 60 million adult Americans have stage 2 high blood pressure, and they don't even know it. And so to Dr. Cohen's point, this is so critical. That's why, let's get past the abstraction of why you should get, to have a PCP appointment. Of course, that's really important. The reason why is that they'll do immediate screens that are very high yield to look at your vital signs and to ask critical questions on, say, smoking, and to provide you cessation resources should you need it, or if this is for a loved one. I like directing folks to validatebp.org. Again, it's validatebp.org. We'll put this in the one pager that comes out of this with Dr. Cohen's great tips on lifestyle changes for sleep hygiene and among other topics. But again, it's really important to keep in mind, I'm not going to be able to, I think, adequately do this, but if you get any of these, this is, I think, $20 on Amazon, really easy to get. You can pick out the ones that are on this website. Any of these work. And again, you just want to make sure that you have your cuff that is appropriately sized for your arm, and that you're lining up all the arrows accordingly. I'm not going to be able to show you guys high fidelity how to do this. And you want to make sure your arm is rested on a flat surface, ideally, because some recent studies, actually, that the PSA we did I think it was last year, it suggested that often a lot of people will tend to keep their arm at their side of their body versus resting on something like a table, and then that ends up causing overestimations of one's blood pressure. So you want to make sure your arm is rested on the table, and you want to make sure you're lining up the arrows on the cuff to basically, and I'll show you this, to basically the center of the opposite side of your elbow here, because that's where the artery is that blood pressure cuff is going to be measuring against. But again, validate.bp.org, really, really critical for all of us. Whether or not you have underlying high blood pressure and you're being treated for it, whether you think you're healthy, everybody should be getting screened for high blood pressure. Some society guidelines say after 18 years of age, we should at least be getting one screen every year. And it's critical because I will say that the thing that we see most often in our hospitals are the end stage results of undiagnosed high blood pressure, which are strokes and heart attacks, you name it. And often it's because people think they're healthy when in fact, they actually have undiagnosed high blood pressure. So really, really important. Mandy, thank you for that. I want to get back to some questions here. Mandy, I don't know if there's anything you'd want to improve on, or anything I got wrong there, or kind of your approach to screening.
That was great. I love the tip about leaning your arm. I think that is often something that folks don't know about. So that's great.
Thanks, Mandy. Okay, we got a lot of questions coming in here. Patricia, I see you at the very top. I have high blood pressure. My doctor put me on amlodipine, and I promised to get to everybody's questions. I'm this sort of recency bias here, reading the first one at the top. And I was put on amlodipine and another pill, but then was taken off. Now, when they check my blood pressure, it's always been very high, and the bottom number is always 90 something, and the top is always higher than 90. Are wrist blood pressure cuffs ever accurate? Mandy, I'll kick it to you first. And
well, first, it sounds like with that I would just say, sounds like time to make sure we're reconnecting with primary care, and sounds like we need some medication. And I don't know why one was stopped. Maybe, again, there are a lot of different blood pressure medicine out there. They have different side effects. You want to be talking to your doctor to make sure that you can find one that both brings your blood pressure down, and you may need two, particularly sounding like you're having high blood pressure. You want to make sure that they're screening you for other things that could be causing high blood pressure, like kidney disease and et cetera. And then, as Vin said, I'm going to turn it back over to him for how to best monitor this for yourself at home.
Yeah, absolutely. I would say, at least once a week, at the same time of day, you want to make sure you get, I'm going to put this back on the screen here just so we're all looking at the same thing. It's so important. We talked about sleep hygiene, and now we're talking about blood pressure. You want to make sure you're going to validatebp.org. It's an FDA. This is a website that's curated by the FDA. These are FDA cleared blood pressure devices. I would recommend getting whatever's comfortable for your budget and checking your blood pressure, say first thing in the morning, after you've been at a seated position for at least, say, 5 to 10 minutes, and checking your blood pressure in the same position, same day, whenever you do it. And I would recommend doing it at least once a week. If you're on blood pressure medications, do it twice a week and track it, because that's the best way to make sure that you're under control. To the person that asked the question, Patricia, I believe, it does seem like we have to make sure we get an accurate reading and that we're on the right meds. Okay, I'm going to go back a bit. Linda, I was going to take this one just in the interest of time here and then throw a few to Mandy. How accurate are sleep metrics on wearables? I sleep soundly all night and feel rested in the morning, but my device reports I sleep about 4 hours on night on average. It sort of asks about accuracy of some of these these wearables that claim to measure sleep quality. I will say that, there's Ring devices out there, not endorsing a specific brand, but for example, Oura Ring is very popular. I don't personally use it, but it's about 75% accurate based on some studies. on tracking deep sleep. And so it's good. It's not as good as polysomnography, which is the type of sleep test you'd get in a hospital setting. But there's also all other problems when it comes to that sleep test, in my opinion, because you're basically getting tested for how well you sleep in an environment that you've never slept in before, in a hospital setting with a bunch of electrodes attached to your head. So it's a little chicken the egg, if you ask me. Are you gonna? Yes, the test might be great, but you're also in a very foreign environment, which might be impacting your sleep quality. So none of these diagnostics are fantastic, but it's pretty good and it's getting better. I'm going to advance us forward just so that we touch on everything, and I'll make sure we get to some questions. Real quick on high cholesterol, 40% of adults with high cholesterol, like LDL, bad cholesterol, so-called bad cholesterol, do not know they have high cholesterol, and they're not getting treated. And so, Mandy, I imagine this is in keeping with your general advice here on just engagement with your medical provider, but whether it's diabetes, whether it's high blood pressure, whether it's high cholesterol, are these tests that people should be asking for of their doctor, or presumably their doctor is going to be doing this already, but wondering what your advice would be to somebody when they're asking questions of their medical provider?
Well, great. One, I think you're definitely hearing the repetitive message of like at least once a year that you are getting an annual exam, man or woman, that you are going in. And we tend to see women go more frequently to their primary care doctors and get routine checkups. We see men doing that less often, want to make sure both are doing it. And I would say your primary care doctor will know which things need checking on an annual basis, depending on your age, your risk factors. So sometimes you can check cholesterol once when you're below 40, and assuming it's in with normal range, then we're good for a period of time. As you age, you're going to want to do more. And of course, as you age, more screening comes into place. Some folks may have seen, I just saw a comedian do a really funny bit about how going to the doctor before you're 40 and after you're 40 feels pretty different, because after you're 40, there's more things to screen and check. Let's just be honest. And then after you're 50, it goes up even more. But the important part is getting there, doing the routine screening, and particularly understanding your family history. So, and because you may be at higher risk even at a younger age. So knowing things about whether or not your parents or older siblings had high blood pressure or diabetes or kidney disease, those are really important things to talk about. And sometimes we often don't share those things amongst family, but to actually make a point of understanding someone's underlying illnesses, even though sometimes it might be hard to talk about, so that we can have good information to then make good decisions for ourselves.
I love that, Mandy. So well said. Mandy and Randy, I was going to throw this to both you and Mandy. But Mandy, to you first. This was up front, one of the first questions we got asked from Linda. I'm very concerned about cuts to the vaccine program and also the food safety agencies. Can you speak to how we can protect ourselves? Mandy, I wanted to throw that to you first.
Well, Linda, thank you for that question. So, I was the CDC director most recently. So I was the 20th director of the CDC. And one of the important jobs of the CDC is to help folks understand what are the recommendations that are needed to keep you healthy. And vaccines have been an incredibly important tool to keep us healthy for many, many decades. Some of you are old enough to remember when we still had smallpox and polio and measles around. And I am lucky enough that as a doctor that I've never seen a case of polio. I've never treated a case of measles, but we know that these vaccines are really critical to keep us continued to be protected. And we're in a moment right now where there's just a lot of misinformation out there. And I think these forums, Randy, that you've put together that are really important for folks to be able to get good information about vaccines. Let me just start with what I do for myself and my kids. I get an annual flu shot. I get an annual COVID shot. I make sure that my daughters, again, who are 10 and 13, most recently got their HPV vaccine, got their meningococcal vaccine, got their flu shot, got their COVID shot. And so, you know, these are things that I don't just recommend as a former CDC director, but recommend as a mom to make sure that, you know, my family is protected, and I want you to do the same. Now, there's a lot of vaccines that are out there. And again, these are where the theme comes up again, going to your doctor and having these conversations, because as you get older, then there are other vaccines like for shingles, for pneumonia, for RSV, all of these things that you're going to want to talk with your doctor about in terms of having it at the appropriate times. But we are so lucky to be in a time where we can have these tools to protect ourselves. Life is hard as it is. Like we're talking about, diet changes are hard and sleep changes are hard and stopping smoking is hard. You know, vaccines are something that we can do to continue to keep us healthy, but making sure to use those tools is so important as we go forward.
Can I, given that I have both of you right now, and I'm glad, Dr. Cohen, I'm so glad that you talked about vaccines, and there was evidently a question before about some COVID issues and about, you know, vaccines and about, you know, whether COVID is an airborne disease or not. I don't know if you want to try to answer some of those or not, but whichever way, it's fine with me. The question right now about what's going on in this reconciliation bill, maybe you can help us. You know, Vin and I were on, when we first saw the bill, we were on one of the shows really trying to explain what the impact would be on real folks, like on, you know, our grandparents who are in nursing homes. So many kids get their health care through Medicaid, you know, funding through the CHIP Act and others. And I think until rural hospitals get basically their funding that way. But you have spent your life in public health. So what can you know, whether it's the House bill or the Senate bill, can you kind of talk about what the real life impact is going to be on public health for these things? You know, not, you know, separate and apart from Kennedy and this one and that one, just the real, you know, what these dollars actually mean in real terms.
Well, one of the most important tools, as you're hearing in our conversation, to keep yourself well is your ability to access medical care, whether that's a vaccine or to go to your primary care doctor, get your blood pressure checked and then get a high blood pressure medicine, right? So, and we all know that having access to that really depends on, do you have an insurance card in your wallet? And what I am very concerned about as we see the current legislation is that we see millions and millions of people are likely to be without insurance because of the bills that are being considered, both changes to the Medicaid program and changes to marketplace coverage. These are the ability for folks to shop on the insurance exchange. I think both of those are going to see more people uninsured, and that means more people without access to whether it's free vaccines or the ability to go to their primary care doctor. And so as a public health person who is saying, how do we give folks the tools to be healthy? I'm very worried that we're taking steps in the wrong direction. Now, Congress still has time to make a change here, and I know folks are making their voices heard right now to help folks know. Because look, when rural hospitals suffer. It doesn't matter what kind of insurance you have. If your rural hospital closes, it closes for everyone, not just for the Medicaid patients. When we don't have programs that fund vaccines, as we know, they are tools to keep you as an individual healthy, but it's a tool to keep communities healthy, right? So we all get a little less healthy and a little less safe when we all don't work together to make sure that everyone has access to the care that they need. So I am worried. I think, I'm still hopeful that we don't see the worst of what some of the proposals have laid out, and that we can keep investing. I think there's been a historic amount of investment in getting folks coverage. It doesn't mean we have a perfect system, right? That was clear at the top of the call, how we were saying, look, it's not a perfect system. And just because you have insurance doesn't guarantee you access. We know there's still not enough primary care docs. We know there's still not enough nurse practitioners. And that's some of the work that AFT does to make sure we have the workforce there. But we can't go backwards from where we've been. And I'm still hopeful that we can make our voices heard and avoid some of those worst changes.
Well, we are trying every day. We're trying to do this. So thank you for answering that. I know we have to go to cancer screening, but think about what we're talking about today. Sleep, walking, enough water, high blood pressure, good and bad cholesterol. This is a great chart that I am going to actually make sure I have. And then also, of course, cancer screening. So I know you have some slides about that as well.
Indeed. Thanks, Randy. Thanks, Mandy. I know that we don't have a lot of time.
Sorry.
Absolutely. No. I was thinking the same thing. Just to wrap this up, a quick word on cancer screenings. And I know there's a few questions in the chat that I promise we'll get to. And if we can't do a full readout here, we're tracking them. I'll make sure that we get responses out. These are the questions you want to make sure. To Dr. Cohen's point, engagement is important. Asking the right questions is critical. Normally, medical providers are already sort of the tip of their tongues is we got to get a cholesterol panel looking for, say, bad cholesterol, LDL, hemoglobin A1C is the test to sort of sense whether or not you might have beyond at risk for diabetes or you might have diabetes. There's newer tests always on the horizon. For the interest of time, we're just going to keep it at this, but I'll put it in a one-pager. So if you say have a family history of heart attacks, strokes, and you're worried about your risk, and you've been told maybe you've gotten screenings that suggest you might have plaque in your arteries or you have coronary artery disease, and you're wondering why. Sometimes these newer tests out there, like apolipoprotein B, lipoprotein A, they're a mouthful. That's when those tests start to become relevant. But again, we're going to try to keep this as streamlined as possible right now, and we'll make sure that you have the ability to ask questions to us, even offline, and we'll get that one pager out to you. Real quick on this, Mandy, you're as CDC Director. You were, I believe, if I have this correct, you were in your role as the Director of CDC when mammogram guidelines changed, if I had that right, from sort of a national society level. Just wondering your thoughts here on utilization or adoption of cancer screening tools across the country and sort of where we need to focus our efforts here to increase utilization.
Well, look, on the screen here, I think it really breaks down by age what you should be talking to your doctor about, but important, not just age. I'll just go back to understanding your family history as well. So important to have those conversations. And I will say, my grandmother, we lost before I was even born, and she had, and you'll all find this pretty common, she died of a woman cancer. And I didn't know for a while, was it an ovarian cancer? Was it uterine cancer? Was it breast cancer? Because that matters to help me as her granddaughter to understand my risk. And so having those conversations, because folks didn't want to talk about it a number of years ago. So making sure we're talking about it and thinking about what is your risk factor also matched with this age screening, I just wanted to say is really important. And again, that's the reason for having an established relationship with a doctor, so they can walk you through when is it right to have a mammogram, and making sure you're doing that consistently. Maybe it's, before the school year starts, so you do it every, August, so you do it, and August is your time, whatever it is. Maybe it's around your birthday. It's consistency. It goes back to the same thing that we were talking about before. The consistency of the screenings is really important. You might think and feel comforted by getting, one mammogram, but that's a moment in time. And then it's about the consistency of doing that and to keep yourself protected.
Thanks, Mandy. I don't know if this video is going to show. Kelly, I think, is it possible, Kelly, to show that video? I don't know if it's populating.
Yeah, it actually, yeah. It is showing right now. There's no sound, but it is showing.
There's no sound. Okay, I want to wrap our conversation.
Mm-hmm.
Okay, great. And I'm going to throw this back to Randy as I'm thanking Dr. Cohen. But just to emphasize what Dr. Cohen just mentioned, I'm showing this rates of cancer screening across the United States in that video that you were just seeing. We could use some improvement. And, I say this, I'm on the board of the American Lung Association, and something that we bang our head against the wall on is that 12% of people in a given year who get paid for access to lung cancer screening, about 12% of people do it. 88% of people do not. They meet criteria. They have covered access to a low-dose CT scan for lung cancer detection. And the reason that matters is lung cancer is the leading cancer-related killer in the United States and worldwide. We have a tool that can potentially increase somebody's lifespan because it helps with early detection if somebody has lung cancer. 12% of people actually take advantage of it. And there's a lot of reasons why. I'm not trying to trivialize the reasons why. You have to take time out of work or get childcare, and you have to make an appointment. It takes time. It's really, it's not easy. But it's also to say we have to be having these conversations more, as Dr. Cohen says, and that's exactly what your PCP is going to do. They're going to screen you for the screenings that you need. And these things are changing in real time. Mammography screening now is at 40 for the general population of women. Just a few years ago, it was at an older age. And so these things are changing constantly. Important to stay engaged. But Dr. Cohen, thank you so much for joining us. I'm going to kick it back to Randy just to respect everybody's window here.
I want to say thank you both to you, Dr. Gupta, and thank you to you, Dr. Cohen. Today, just like so many of the others that we've done, I feel like this has really been such a gift, and for you doing this with us and for our members and for those, and all the follow-up. But what is really important about today, just like, when we're talking about women's health and when we're talking about, what happens with kids and what really is ADHD and things like that, is we're trying to break things down for people and make it real and accessible. And I think you just made a lot of things really accessible to people. As you were talking, I was thinking about how, as Dr. Cohen was saying, the women's cancer. I remember when my grandmother died of the women's cancer. I remember when, we started with screening and what did it mean, and promising my mother that my sister and I would get the BRCA screening and all of that stuff. It's scary. It's really, really scary. But if we take these kind of baby steps to actually help ourselves, we're going to help a whole lot more people if we take care of ourselves. So good night's sleep. Maybe put that cell phone in like a pocket instead of having, playing that game at night, not listening to a podcast at night to try to go to sleep. Maybe reading a book or something else, getting some sleep, drinking a lot of water. It's really hot as hell out in the East Coast right now. Drink water, having those, I love that, the Fitbits or the other kinds of things that you can wear so you can do your steps. Having some competitions like we do, Kelly, at the office about, the number of steps each of us do. But thank you so much for doing this with us today. Our wellness is really important to ourselves and our families. And here are some really, 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 really important steps to do. I want to just announce that next year we're going to start doing things on you see where it says unplugged from screens 30 minutes before bed. We're doing a lot of research about what those screens really have done to us and to our kids. This is part of the reason why some of our locals and state federations like NICET have really pushed for distraction-free schools. Our Cleveland local was the first one to do a collective bargaining contract to actually reduce those kind of distractions. And, I'm proud to announce that that starting probably in August, we're going to have Jonathan Haidt, who wrote Anxious Generation, and we'll really start getting behind the science about what's going on in terms of social media and these distractions and how we help ourselves and our kids with it. But I just want to say, as we end this year, or it's the summer. I know the summer for us, those of us who are schools people, the summer does feel like the end of a school year and the beginning of the next one. I just want to say to you, Dr. Cohen, thank you very much. And frankly, if your parents are still alive, give them a hug for teaching in the New York City public schools for us. Thank you, and thank them. And thank you for your service. It's not easy to do the work that you do in public health. And you've been, my friend, you have been a gift for so many of us. And I just want to say thank you for all of what we've done this year together, and we'll do so much more next year. And for everybody else, take a little bit of space, have a little bit of light as we fight demons and anxiety and all the things that are there. I am just really, 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 really honored to represent all of you as we fight for fairness, as we fight for opportunity, as we fight for dignity. And please take a moment to take care of yourselves. You deserve it. You've earned it. And just God bless you all. Thanks, everybody.